A COVID-19 surge is overwhelming Nepal as India's outbreak spreads across South Asia. Hospitals are overflowing with patients, with towns near the Indian border unable to cope. Nepal is now recording 57 times as many cases as a month ago. Experts warn urgent action is needed to prevent a worsening human catastrophe. And for a closer look on this, we're joined by Azmat Ulla from the International Federation of Red Cross and Red Crescent Societies. Thanks for joining us. Firstly, get us up to speed with exactly how bad the situation is in Nepal.
Yeah, the situation is quite alarming, as you just mentioned. The rate of infection has increased by over 50 times in the last month. And if you look at the figures in March, for example, we are talking about 100 infections a day, but day before yesterday, the infections were over 7,000.
Mr. Ulla, how did matters reach this point, though?
Yeah, there are a few points here. First is that, like with many countries, Nepal had its peak in October. And since October, like in many places, people will be a little bit fed up with wearing masks, social distancing and all that. But in the case of Nepal, with lots of people still living under the poverty line, sometimes one has to balance livelihood with restrictions, because especially with daily workers, if they do not work that day, they may not even get food. So this is a big challenge. And thirdly, there's obviously the variants. The variants are faster, much more aggressive, much more contagious, and it's affecting a bigger spectrum of the population, including the younger age ones.
Yeah, speaking of the variants, many cases are said to have been spread from India, from the India variant. Would a full border closure help?
Yeah, there are already restrictions in place. And there's also a lockdown in Kathmandu as well. So restrictions are in place, and we are also working with the Red Cross is also working with the authorities and the borders to do more dissemination, preventive measure, and helping quarantine cases.
Well, vaccinations would help this situation in time to come, of course, Mr. Ulla, but Nepal is struggling with a slow pace of vaccinating people now.
Yes, in the more well-off countries, as you know, we are talking about maybe certain populations reaching 50% in terms of vaccination. In Nepal, it has only reached 1%. So this is a challenge.
And what do you think needs to be done then to to get Nepal through this crisis?
Yeah, I think we really need to do everything we can to scale up and with speed to scale up preventive measures, medical services, and vaccination efforts.
All right, well, many thanks for your thoughts this evening. Mr. Azmat Ulla from the International Federation of Red Cross and Red Crescent Societies.